Welcome to the Human 5 Project, the podcast where we cut straight to the breakthroughs that matter, the show where science meets self-optimization. I'm your host, Ultimate Biohacker 10X, and here we break down the real research, real data, and real dosing behind modern biohacking, from compounds and peptides to techniques, devices, lifestyle strategies, and performance protocols. Most people jump in and jump out before they get the gold, so we're keeping it tight and delivering the essential insights you need without the fluff. If you've taken the time to hit play, we'll make sure you walk away with valuable knowledge that can transform your approach to longevity, health optimization, and beyond. Welcome back to the out-of-the-box segment of the Human 5.0 Project, the segment where we leave the guidelines on the shelf and explore the truly unconventional, the emerging, and the what if we tried this approaches in neurology and regenerative medicine. I'm your host, Ultimate Biohacker 10X, and today we're doing a full case review on one of the most requested topics from our listeners, dementia, specifically Lewy body dementia, and the out-of-the-box toolbox. We've got a 76-year-old man, let's call him Mr. R, with early-stage dementia and Lewy bodies. Main symptoms right now, occasional visual hallucinations, no major heart disease, diabetes, or other comorbidities. Cognition is still pretty good, but the family's motivated. They've asked the question, the one that we all hear in the clinic. Well, what else is out there? We'll travel, we'll try peptides, we'll fix the gut. Just give us options beyond the usual pills. Today, we're going full fringe to frontier. We'll rank the ideas by evidence, risk, and realism in 2026. Let's dive in. All right, the case snapshot here. Mr. R is a 76-year-old male, early Lewy body dementia, occasional hallucinations, independent in most ADLs. MoCA is probably in the low to mid-20s range, although we don't have exact numbers. Standard of care would be rule out mimics, optimize sleep, consider low-dose pimavanserin or quetiapine if hallucinations worsen, and push exercise and Mediterranean diet. But the family wants the experimental lane. Okay, so leaky gut and the microbiome. Is this really worth the hype? First question the family asked, should we test for leaky gut and fix it? Well, the gut-brain axis is real. Alpha-synuclein pathology can start in the enteric nervous system years before brain symptoms. Dysbiosis and increased intestinal permeability are documented in Parkinson's disease and dementia and Lewy body dementia. But here's the 2026 reality check. There are 0 randomized trials showing that treating leaky gut reverses or even meaningfully slows established LBD. Verdict? Not top of the list, mid-tier, supportive move. Practical steps? Stool test for zonulin, calprotectin, microbiome diversity, and it's cheap and harmless. Mediterranean or MIND diet, fermented foods, multi-strain probiotic with lactobacillus and bifidobacterium strains that have PD data. Low risk, low cost, possible bonus for mood and sleep. Do it, but don't expect it to turn the disease around. Okay, next, peptides and nootropics. Now we get to the stuff that lights up longevity in regen med forums. Cerebrolysin, the pig brain-derived neurotropic factor, par excellence. This is the most studied of the peptide group. Small trials in Alzheimer's and stroke show modest temporary cognitive and mood benefits. Preclinical data exist in alpha-synuclein models, but no dedicated LBD human trials. It's given as IV infusions, usually 10 to 20 days. Clinics in Mexico and some Eastern European countries offer it routinely. Realistic expectation? Supportive at best, maybe a little sharper for a few months, maybe fewer fluctuations, not disease-modifying, and safety generally good if sourced properly. Cmax and Noopept. These are nasal peptides popular in Russia and nootropic circles. Animal data, some anti-inflammatory and BDNF effects. One in vitro study even showed Noopept sequestering alpha-synuclein oligomers. Human data in LBD, essentially 0. Verdict, highly experimental, reasonable to trial in a structured clinic setting if you're already traveling for cerebrolysin, but don't make this the centerpiece. L-serine, this is the amino acid hypothesis, and it's based on the BMAA toxin theory, the environmental trigger that gets misincorporated into proteins instead of L-serine, causing misfolding. It's plausible on paper, and trials are ongoing in ALS. There's no LBD data, it's cheap, it's oral, and it's very low risk. Verdict? It's an interesting science project, but not a treatment yet. TTP34, Titer Trophics, brand new cyclic peptide targeting lysosomal and mitochondrial dysfunction. It just entered human testing in Parkinson's this year, in January, mechanistically beautiful for synucleinopathies, but years away from availability. Okay, let's hit the deep regen lane. Stem cells, nebulized exosomes, and the real-world Cerebrolysin protocol. This is where things get very out of the box. A lot of motivated families end up in medical tourism clinics in Mexico, Germany, or Thailand, and now in Florida, looking for a combination of regenerative packages. And here's the 2026 landscape. Cerebrolysin abroad is the most common and refined protocol. In experimental clinics, the standard course is 10 to 30 mLs IV daily, some up to 50 mLs in severe cases, diluted in 100 to 250 milliliters of normal saline or glucose, infused slowly over 30 to 60 minutes to minimize side effects. Most centers run 10 to 21 consecutive days, with some offering a second booster course 3 to 6 months later. There are numerous clinics now bundling it with other therapies. One popular package at Geostar combines 50 million allogenic mesenchymal stem cells and cerebrolysin in the same treatment week. The idea is synergistic neurotrophic and anti-inflammatory effects. Safety track record is solid when sourced from legitimate manufacturers. Side effects are usually mild, like headache, nausea, injection site irritation. There are no dedicated LBD trials, but the protocol is the most standardized of the fringe options and is the one most clinics have the most experience delivering. Stem cell treatments for LBD are offered in the same destinations, plus the Regeneration Center in Thailand and some German centers. Most common would be allogenic umbilical cord or adipose-derived MSCs, 50 to 100 million cells, roots, IV infusion, intranasal, or rarely intrathecal. The rationale is paracrine anti-inflammatory and neurotrophic signaling to support surviving neurons and reduce alpha-synuclein-driven inflammation. PD trials, for example, Hope Biosciences Phase 2 in 2025, showed motor improvements. LBD-specific data remain mostly anecdotal or small open-label series. One Thai program specifically markets neural stem cells for Lewy body pathology. Reality check here, these are not disease-modifying in the rigorous trial sense. Results vary widely. Risks include immune reactions, infection, and theoretical tumor promotion. Only consider centers with on-site neurologists, transparent cell sourcing, and published safety data. Nebulized exosomes, which would be the newest and least invasive option. Exosomes are tiny signaling packets released by stem cells, usually umbilical cord MSCs. A few clinics now deliver them via nebulizer. Patients breathe in a mist for 20 to 30 minutes per session, often 5 to 10 sessions over a week. The claim is that exosomes can reach the brain via the olfactory nerve or bloodstream, delivering anti-inflammatory and regenerative cargo without needles. Evidence level? It's early. A January 2026 first-in-field case series, 8 patients with various neurological conditions, including one with dementia, reported clinical improvement in 7 out of 8 cases, but the dementia patient did not improve. Preclinical data in stroke, TBI, and PD models are promising, with reduced inflammation, better neuronal survival, but no randomized trials in LBD or even dementia are ongoing at this time. Clinics offering it usually charge less than full stem cell packages and market it for brain fog, neurodegeneration, post-COVID neuro issues, etc. It's non-invasive and low risk on paper, but long-term safety in older adults with LBD is unknown. How do these fit together for Mr. R? Well, if the family is already traveling, many clinics now offer cerebrolysin and MSC infusion, or cerebrolysin and nebulized exosomes in the same 10 to 14-day trip. That's the most common regen stack in 2026 medical tourism for early LBD. Verdict on this tier? These are true frontier treatments, supportive at best, highly experimental, and not proven to reverse LBD. The strongest real-world signal remains Zervimesine, which is up next. Use the regenerative options as adjunct while waiting for trial access, not as the main strategy. Vet any clinic aggressively, publish safety data, proper cell and exosome sourcing, and pre and post cognitive testing. Okay, the current frontrunner, Zervimesine, CT1812. This is the one that actually moved the needle in 2025 and 2026. Zervimesine is an oral, once-a-day small molecule that displaces toxic protein oligomers, including alpha-synuclein, from synapses. The The Phase 2 SHIMMER trial of 130 patients with mild to moderate DLB was fully published in Alzheimer's and Dementia in late 2025 and early 2026. Key results: primary endpoint, safe and well tolerated. Secondary signals, directional but encouraging. Neuropsychiatric inventory, improved versus placebo. We're talking hallucinations, anxiety, and delusions. Fewer cognitive fluctuations, better activities of daily living. Motor scores held up better, the MDS-UPDRS. This is the first oral drug to show this kind of multi-domain signal specifically in DLB. Access in February of 2026. The EAP, or Expanded Access Program, enrolled 32 patients and is now closed to new enrollees, but existing participants just had their treatment duration extended beyond the original 12 months. This is promising. The company met with the FDA in January of 2026 to plan the next study, so keep an eye on clinicaltrials.gov and cogrx.com. The next trial sites could open later in 2026. So if your patient fits mild to moderate DLB, this is the single most credible out-of-the-box option right now. All right, let's put it all together. A realistic 2026 plan. Here's how I'd sequence it for Mr. R. Highest priority, monitor for Zervimesine next trial or any remaining compassionate use pathways. Contact Cognition Therapeutics directly. Reasonable add-ons while waiting, 10 to 20 day IV Cerebrolysin course, combined with hyperbaric oxygen or TACS if the center offers it. Supportive baseline, gut optimization, test, diet, probiotic, Mediterranean diet, vigorous exercise, aerobic plus resistance. This is the strongest real-world data that we have. Music therapy, good sleep, etc. Experimental extras, consider layering C-Max nasal or oral L-serine, but these are true long shots. Standard care still matters. Don't drop pimavanserin or cholinesterase inhibitors if symptoms progress. If you're heading abroad, look for on-site neurologist, transparent sourcing, and published safety data. Many combine cerebrolysin with other peptides. Ask for the exact protocol and rationale. And if stem cells and exosomes are available, we already know these are part of these protocols. Final reality check here. Nothing on this list is proven to reverse LBD. The best realistic outcome is slower progression and fewer hallucinations. Zervimesine is the closest thing we have to a legitimate disease-modifying signal in DLB right now. Everything else is supportive or speculative. So that's our deep dive on out-of-the-box options for early Lewy body dementia. If you're a clinician or a family member dealing with this, drop us a note. We may do follow-up episodes on specific clinics or trial updates. Remember, this is educational only. Nothing replaces a thoughtful conversation with your neurologist. Thanks for listening to Out of the Box. Stay curious, stay critical, and stay informed. And we'll see you next time when we tackle another frontier topic. It's Ultimate Biohacker 10X. I'm out. Thanks for listening to the Human 5.0 Project. If you found value in today's episode, share it with someone who's ready to elevate their biology. Make sure to follow the show for weekly deep dives into peptides, protocols, devices, lifestyle strategies, and the science of high-performance longevity. Until next time, stay curious, stay optimized, and stay 10X.